So you've had a diagnosis of fibromyalgia, possibly given by a specialist in the community or by your GP or maybe by a physio or some other professional. And you've been referred to the pain clinic, but the waiting time to see the specialist pain doctor or the rheumatologist is very long. What do you do? What can you do to look after yourself and to understand this condition better? I do a lot of talks and support to patient groups in the local area where I practice. And over time, this is a very common question that a lot of patients ask me. What can they do while they are waiting for treatment, or what kind of ways can they support themselves? I think this is a very critical question and something that is very important so that you can feel in control, that you feel that you have the knowledge to make some decisions for yourself. Very important to understand when fibromyalgia is often a condition that many people still don't believe it exists, or your family members and your near and dear ones may not understand what you go through, and you're left dealing with it on your own. So what can be the ways you can look after yourself? Firstly, I think the most critical thing is to understand the condition, is to have an awareness and knowledge of why it has happened. I have done other videos where I go into the causes in more detail, but on a broad overview, fibromyalgia is a condition where your nervous and immune system have got sensitized. It's a form of what's called chronic primary pain. So there's no evidence of injury to any part of your nervous system, and there's no evidence often of any inflammation on your blood tests as well. So that's the big reassuring part, is that there is nothing sinister or serious going on for this diagnosis. It is a question of oversensitivity, and the hope and the good thing is that this sensitivity can be reduced if you know what can be the triggers. And so the first step is to understand why this condition has happened. The second step is to understand what might be the triggers for your nervous and immune system. Now, apart from the usual suspects of a surgery or an injury, other triggers for your immune system are usually diet and gut related changes. Other triggers for your nervous system can be stress, can be lack of sleep, can be work conditions, can be some other form of trauma. All of these are likely triggers. So knowing the triggers is important. Knowing why the condition is happening is important, because both of these will give you tangible options that you can do yourself. You can start some treatments and some ways of managing it yourself. What are the various things you could do to improve nutrition, to improve sleep, or to think about other mind-body techniques? Now, I understand that sometimes doing this all by yourself is challenging. So there are already some very useful resources, and I'm going to be looking at it from the perspective of someone living in the UK or in the Western world, in the US or in Europe. What are the resources I recommend to patients in the clinic while they are waiting for further treatment? Firstly, I ask them to check out a website called Live Well with Pain. It's a free website that was started by patients and other healthcare professionals during the pandemic. It's got a wealth of resources for people diagnosed with fibromyalgia. All of it is free. There's videos, there's audios, there's blogs, there's podcasts. So choose your way of understanding and finding out about the technique, and that will be available, and it's all free. So check out livewellwithpain.co.uk. The second resource I recommend is Curable. This is an app that is predominantly from the US. A lot of the input and the content is US based, but they take the approach that when you've got fibromyalgia or conditions where the nervous and immune system have been overstressed and oversensitive, then they introduce a lot of information, not just about education, but also about non-drug techniques to calm the overly sensitive and traumatized nervous and immune system. Check that out again. There are a variety of options. Some of it is behind a paywall, some of it is free. There are the opportunity for groups within there, so do that. And I think I would really recommend those two options as a first. There are some other resources that come from the Fibromyalgia Association UK, which have got some on their website, the Fibro Concern website, as well as other pain-related websites from the British Pain Society and the Flippin' Pain Organization. A lot of these are also there in my book that's available there, and we can support and do help patients with further signposting and access to other group ways, other health coaches who can help support you there, other advice people can get about nutrition or mind-body techniques, and all of these will be further available as well. So I hope you found this empowering, found this video useful to give you some good points to managing your condition while you're waiting for official help. Thank you for listening to this video, and I'll see you in the next one. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.